Hello students, we will discuss a very commonly used tube today. What this tube is, look at that lengthy tube. Here two sides are there. Here side opening is there. There is a balloon here, like this. And it is like this, it is like this, like this. And it is a color here in this. This is urine to come out. Here side opening is there. So what is this tube? You can see that color, you can see 30 to 50 ml is named here. It is Foley's urinary catheter. See that very commonly kept tube. Foley's was an urologist who invented this catheter from USA. So features are, it is a self-retaining urinary catheter. It has got a balloon at the just proximal to the tip, where you have to inflate the balloon once you pass the catheter inside and through distilled water, not normal saline. If you put normal saline, it will get crystallized. You may not be able to deflate it and removal will be problematic. Never use normal saline, no air at all, of course. Use distilled water, distilled water, distilled water. That's the most important thing. There is no opening in the tip. Only side openings are there to drain urine. Different size comes 10, 12, 14, 16, 18, like that. Each size 10 and lesser than that usually used in pediatric age group. Adult it is 14, 16, and in surgery, urology surgeries or prosthetic surgeries, it is 18, 20, like that it is being used. Wider one, thicker one. Each has got different color cover here. See that color, this is the red color. So different color has got different thing, I will show that one. And amount of distilled water infused are labeled here, 30 to 50 ml. See that, 30 to 50 ml. This is the red color. So that is labeled there. There is a balloon in the tip actually, like this. So here opening, here balloon. So to the side channel, here it get inflated with the distilled water. So that is this balloon should be inflated. You should write down how much distilled water you use to inflate the balloon. That is very, very important, because this balloon makes the catheter self-retaining. It can be two-way, it can be three-way to give a wash. Usually in urology surgery, it becomes silicone coated, because this traditional Foley's catheter is made up of latex and it is kept for 1 week. If anything more than that, you should use silicone coated. You can use it up to 3 months. It can be hematurid type, and unit called is French unit, otherwise called a Charrier unit. 16F is the one which is commonly used. Charrier unit is circumference is 16F means 16 millimeter in circumference. So diameter is 1/3. So 12F is 12 millimeter in circumference. 10F is 10 millimeter in circumference in millimeter, not radius. And its diameter is 1/3 of that. So 16F is 16 meter circumference, 1/3 of the diameter. So bigger the number, bigger the tube. Lesser the number, the smaller the tube. That is the point you have to remember. So 16F is very commonly used one. So remember aseptic precautions while passing the urinary, clean and drape everything. Then apply jelly, sterile lignocaine jelly. Rinse the urethra properly. Then gently pass the catheter. Usually catheter sterile plastic coat cover is there for the catheter. Tip is only tip of the plastic cover is removed, and so no touch technique it is passed. What is called the no touch technique, and with that it is passed per urethra into the bladder. Once it reaches the bladder, you can see the yellow colored urine coming out through the draining channel, and once it is coming out, push further then to the inflating part, inflate the balloon using distilled water. So that is how aseptic precaution is very, very important. And in male, you have to retard the prefuge while passing the catheter, and once you pass the catheter, inflate the balloon, and you replace the prefuge back. Otherwise, paraphimosis occurs. It's very, very important. And also remember, pull and confirm that balloon is inflated, balloon is properly inflated, and push it back. So these are the methods. And then also draining end connected to the urosac back to drain continuously. So remember difficulties in passing in a stricture, adult, prostate enlargement, trauma, you may not be able to pass properly. If there is a phimosis difficult to pass, you may have to give a dorsal clut. Remember complications, infection, urethritis, cystitis, encrustation. If you keep longer time, stone formation, stricture formation, false passage, extravasation of urine, all those things can occur. Sometimes difficult cases you use, there are two types of introducers are available. One is curved string like, another is with a notch over the outer surface, that is called Merrifield introducer. It's very popular introducer for the Foley's catheter, what is called as Merrifield. The curve there, with the tip there is a button where you can hold that Foley's catheter, so that guide into that, because it's very stiff, so that it enters the bladder properly. So this is called Merrifield introducer. So that also can be used. And remember, see here different colors, small one, blue, this is white, this is green, red, not red, orange, red, and yellow. So different sizes got different color. That point is to identify, actually, especially in the OT people or helping technicians or nurses, so that you won't get confused what size is used. Of course, if for each different quantity of distilled water should be used for inflation, it is actually labeled there. You can see that one and confirm. So again, see that it's a magnified view, blue color, green color, white color, orange, red, and yellow for a different size. And this is three-way Foley's catheter. See that? See that one for draining the urine, another for draining urine, another for irrigation. This goes inside and irrigates this. So in a prostate surgery or in bladder surgery, to prevent clot formation within the bladder, it's very dangerous. It may cause anuria. So it gives a continuous irrigation. So other end comes. So it prevents the clot formation inside. And this is of course traditionally for inflation using distilled water. So this is three-way Foley's catheter. Again, in urology procedure, very useful. So answer the MCQ. Kirvin's operation is done for duplication of renal pelvis and ureter, retrocaval ureter, solitary renal cyst, erythrocyl. Another MCQ. Answer the MCQ. Another one. What is this tubes? What is this tubes? Red rubber catheter, Melicott catheter, Foley's catheter, Gibbons catheter. So students, answer this MCQ for tomorrow in the comment box. So I'll give the again proper answer, whether you are correct or not. Please request everybody to give the answer in the comment box. Go through my clinical methods in surgery with videos for each examinations. In detail it is there. And manual of surgery or CBM syllabus for UGs and PGs. In detail, all chapters are covered. Operative procedure 2 volume book covers everything, surgical technique and principles, tissue approximation, video, basic about tissue suturing. And my DigiNow lectures, surgery, entire topics are covered, include specialties, instruments, operative surgery, specimens, and so on. Whatever required for CBME students, you can always purchase for 1 year through JP Publishers. So you can have the easier way of learning surgery as such. Even for PGC, it is very useful. So students, I hope you understood this one very well. Thank you very much.